Good afternoon, everyone, and welcome to part one of the Diversity and Inclusion in Academic Medicine, a Strategic Planning Guide webinar. My name is Kevin Jerome Watt, and I'm the Central Regional Representative to the Group on Diversity and Inclusion Steering Committee, as well as the Assistant Dean of Diversity and Inclusion at Wright State University Boone Shaw School of Medicine in Dayton, Ohio. We hope that you will enjoy the program we have for you this afternoon, and we'll try to keep it fairly succinct, and noting that we'll have plenty of time for questions and answers at the end of our program. We designed this webinar knowing that diversity and inclusion is very close to many of our hearts, and many of us want to get this closer to our hearts. We often had focused a lot on in student affairs, but we also know now that with the advent of GDI coming into existence as a group, that the faculty and staff are just as important as we go into medicine. So what we're going to do today is we're going to look at this strategic planning guide, helping to identify some of the groundwork that we need to create some institutional buy-in and commitment from all of those in our respective institutions, noting that every institution is set up a little bit differently. I think we have some folks here that will be able to get us going in various ways, as you'll see in the coming moments. So what do we have to do? We have to identify those who are champions, those crucial people in your leadership that you need to get to endorse it, but more importantly, that you need to get to support the planning process. And as we all know, the metrics of the situation is really where the money is. So we need those metrics to be used to establish a rationale for change and evaluations of the methods that are going to lead us to have a successful strategic plan. I'm going to turn over now to David McKnight, who's going to introduce those others who will be participating with us today. David?
Thank you, Kevin. I'm David McKnight. I'm the Associate Dean for Equity and Professionalism at the University of Toronto Faculty of Medicine and the Northeastern Representative to the Group on Diversity and Inclusion Steering Committee. And it's my pleasure to introduce your panel for today. Dr. Maria Soto-Green is Professor and Vice Dean at Rutgers, New Jersey Medical School. She has over 30 years of experience in all aspects of medical education. She is committed to advancing the school's cultural competency education and has collaborated with other medical schools to attract and develop underrepresented physicians and non-physician scientists for successful careers in academic medicine. Dr. Soto-Green is a past chair of the AAMC Group on Diversity and Inclusion. Dr. Deborah Plummer is a psychologist and a nationally recognized diversity management thought leader. She currently serves as Vice Chancellor Diversity and Inclusion and Chief Diversity Officer at UMass Medical School and UMass Memorial Healthcare. She's a professor in the Department of Psychiatry and Quantitative Health Sciences. She has published extensively in diversity management. Dave McIntosh began in May 2013 as the inaugural Assistant Dean for Diversity in the Texas A&M College of Medicine. He has worked to institutionalize diversity by leveraging assessment and data to create initiatives to enhance the experience for all faculty, students, staff, and administrators. Previously worked for nearly 10 years in the Office of the Vice President and Associate Provost for Diversity at Texas A&M. He also serves as a Southern Regional Diversity Representative for the AAMC Group on Student Affairs. Linda Ryman has the dual role at Washington University School of Medicine, WUSM, as the Assistant Dean for Strategic Planning and as Executive Director of the Joint Office of Strategic Planning for Barnes-Jewish Hospital, St. Louis Hospital, and WUSM. She has been at WUSM for 19 years and in her current role since 2003. Originally from California, Linda has a previous healthcare experience in managed care contracting on both the health plan and the provider side. With that, I am pleased to turn you over to Maria.
So I'd like to welcome everyone to our wonderful conference, our webinar. And for the next 10 minutes, I will focus on and describe for you how to use the AAMC Diversity Strategic Planning Guide. Further, I will describe or illustrate the diversity journey of Rutgers, New Jersey Medical School that informs our strategic planning process. As you look, the face of America has changed, and therefore it's become an imperative that we prepare and have a workforce that is able to meet the needs of our community. So we turn now to the guide. And I'd like to call attention, there are 9 essential tasks that we should look at in constructing how we approach our diversity strategic planning process. I will take you through some of the early essential tasks that are critical as you plan your journey in this area. So the first and very critical is to think about your team. Think about those that are external, think about those that are internal as well. And I'd like to start, with a quote as we think about this guide and the work that we all do. Albert Einstein once wrote, "Insanity is doing the same thing over and over again and expecting a different result. Diversity necessitates a diversity of thought and experiences." And yes, when you look at the list of the key stakeholders, it's always critical to include those that are the doers that we all know too well, but also the naysayers. And what I would like to leave you with as you think about essential task number 1 is be methodical. As you put your team together, do not think about those that immediately come to mind. So for example, from myself, I look at rosters of faculty, staff, students, administrators, and I also look at the different skill sets and experiences that they have to offer. So as you move on in thinking about, the next essential task, it's critical to assess your landscape. And this is just simply illustrating when we were preparing for the LCME, and as those of you have come to know it as IS-16, and I know the numbering has changed, but the intent does not differ. I looked at it in a very comprehensive and holistic approach. So core to moving forward, as anything that we all do in academic medicine, it's critical that you look at data and that you actually document what you've actually accomplished in this arena. So the next slide, in our assessment is just brief, is an abbreviated diagram that really just depicts for us the diversity journey of Rutgers and JMS. What I've highlighted here are the milestones. With the assistance of our stakeholders, what we did was we reflected on our achievements and challenges, but we took it a step further and considered the factors that affected our achievements and challenges. And in doing so and preparing for the remaining tasks, it was critical that when we looked at the factors, we considered both the facilitators and barriers as we planned our move forward. And so this is our depiction when we did our early needs assessment of our 40-year journey. You can see we're in the wonderful city of Newark, that's our campus. But more importantly, it is about the future generations. On the left, you can see our matriculating class, just a segment of our student body last year. And on the right, it's the robust pipeline programs that we feel are vital to preparing the future. And so it's critical as you think about the next task and everything that we do, you always need to have, what is the driver? So it's important to look at your leverage points. For us, at the particular time, it happened to be the accreditation. And if you look, I've, put forth some of the accreditation levers. I just not only addressed it from LCME, but most of us reside in institutions that do graduate medical education. We also, as academic health centers, look at all aspects, both legal, ethical, and regulatory. The other, for me right now, as I look at it, and I think the most specific thing that we also need to think and keep in mind as you look at your leverage points is to look at what dimension of diversity is it that you seek to address. And think about these tasks not as happening in a linear fashion, but they're happening concurrently. So for us, obviously, the task 1 and 3 were happening simultaneously. Just thought I would take a quick moment. For me personally on this journey, I think that the new clinical learning environment review and CLEAR provides yet another dimension of a critical opportunity, and amongst its focus areas, it brings forth quality improvement, but it particularly challenges our institutions where our residents reside in focusing on what is the healthcare disparity quality improvement plan. So we should always think about, what else is coming to the forefront that will help us leverage what we want to accomplish. And then we were at a wonderful critical juncture in that not only were we preparing for the LCME, but it was also a time of a newly appointed dean, and we were undergoing our strategic planning process. And so we used both elements interchangeably, and as we took forward the dean's charge in terms of redefining our mission and values, you can see that it's core to us that diversity is there, that service to our community is there, but it was really vitally important that we have a broad representation of all the constituents and that we have the appropriate degrees of overlap, so that way we were able to have this in a very bidirectional way and also be able to garner even greater allies and champions. And so I just also urge all of you that it's important when you think about your levers, and you could argue the overall lever was LCME, the overall one was IS-16, is not to look at it as diversity existing in a silo. I point these out because these were all of the elements, while they cut across the various sections of our self-study, that we use to help inform that one standard. So you can see it range from strategic planning to cultural competency to the admissions process to the faculty themselves as well as our affiliates. And so in getting ready to close, what I would argue for us, we were very excited. Our particular achievement was that we have a strategic plan that particularly, and I've just highlighted goal number 3. And as you can see, in addition to wanting to prepare individuals for the future, for the first time we actually put innovations in education to prepare students and trainees. So we now introduced that it was critically important that we think about our trainees in terms of our graduate medical education residents and fellows, and that we prepare them with a focus, particularly in the area we reside, on the health of underserved and vulnerable populations. So as I leave you and move to Deborah Plummer, I think it's vital to know that in the LCME, the specific finding was that NJMS has a commitment to diversity and has fostered a spirit of inclusiveness for its highly diverse community, faculty, staff, and students. So again, I thank you, and I will pass this to Deborah. Oh, there we go. Oh, sorry. Oh, okay. Yes.
Thank you, Maria. And greetings to everyone, and thank you for joining this conversation. We're now going to spend just a few minutes drilling down on the metrics and evaluating your efforts using the strategic planning guide. A brief overview of what we're going to talk about in these few minutes are, first of all, what do we mean by measurement? And then when it comes to diversity, what exactly are we measuring? I know that sometimes that can be mind-boggling. And then how do we compare with other medical, academic medical centers? I want to start by just making a distinction between three aspects of measurement and metrics that are related, but yet it really adds to your effectiveness if you're clear on what you're doing in this. And that was very important for us to start with looking at that. Looking at the overall goal of assessing, measuring, and evaluating, in the sense that that's about determining the impact of our diversity initiatives, both on the individual but also on our organizational performance. And the goal of doing that was so that we could continue to make informed decisions and keep this as a continual process. So we looked at first assessing, and that is really more about determining exactly what the focus should be so that we weren't just throwing arrows out, in the dark, so that we could really make sure we were addressing the opportunity or problem, and that we were all on the same page about what the opportunity or problem was. Secondly, we're also measuring, so we're trying to quantify the outcomes of what needed to get done vis-a-vis that opportunity or problem. And then lastly, evaluating, and that was making the decision on the basis of that, what we found out in the measurement regarding the effectiveness of that intervention on that opportunity or problem. So these were very important concepts to support creating a strategic direction for change that's also incorporated in the strategic plan. I want to talk a little bit about each of these and give you some examples of how we employed them at University of Massachusetts Medical School. One of the things for us was to get clear on what were our overall metrics. So this is kind of the 30,000 feet picture of what we were trying to achieve. We were measuring our success by how well did we prepare the culture in terms of readiness for managing diversity? How well did we facilitate the education and the practice of cultural competence? Were we connecting the dots of all the diversity programming with the institutional strategic goals so that we just didn't have a series of unrelated events and unrelated activities and initiatives that weren't really mapped to the whole institution's strategic goals? Were we creating conditions by which those differences could be leveraged to establish an inclusive academic community? So not just measuring how many individuals we had in terms of representation, but really how, what kind of policies, practices, procedures did we have that were helpful to us in leveraging the diversity. And then the one thing that we also wanted to do, since that diversity is something that's not static, was to anticipate on behalf of the institution any diversity-related trends that we needed to pay attention to as we move forward, so that our end game ended up being that we could create that inclusive academic health science center that we wanted to have. So the metrics process looked like this. In the assessment, it was important for us first to get conceptual clarity on what constitutes diversity for us at UMass. Even though there are many great definitions for diversity and people have lots of ideas about diversity, it's so broad, and we wanted to make sure everyone was grabbing the part of the, that we were grabbing the same part of that big elephant. We also wanted to make sure in the assessment process that we were aligning with our mission, vision, and values, and that, again, that it was flowing from our central strategic plan. When we were measuring, we were looking at the development of a meaningful scorecard that would depict the stage of development, realizing that this is a stepwise process in terms of how we did this work. And then evaluating, we wanted to make sure that we're also utilizing benchmark data, because we knew that if we just evaluated ourselves and could pat ourselves on the back, everybody's kind of virtuous on an island. And so we wanted to see how well we were doing against other academic medical centers. And that would help us to analyze the impact then of our work. So assessment. We first wanted to gain, as I said, conceptual clarity on what diversity meant for us. So we did a roadshow, actually, about 5 years ago, asking all of our various stakeholders to tell us about diversity from their perspective. It was a great conversation, and then we narrowed it down to actually 5 components that we looked at in terms of diversity. The first was that of our core values. People really saw diversity as a part of embodying civility, mutual respect, and mutual perspectives. We also looked at it as inclusion, again, creating those conditions that could drive our mission and achieve our goals. We also looked at it as economic empowerment, so making sure that we were organizing all of our business processes to promote minority participation that was reflective of our diverse community, and that diversity was also contributing to the economic growth of the community as well as our institution. We looked at it as equity as well, organizing processes and establishing policies to make sure that we had access and success for our women and our underrepresented groups, and that also there's fair treatment for everyone here. And then lastly, the 5th component was that of representation, which is the traditional way people usually think about diversity in the sense of the numerical and proportional demographics of our academic environment. So we knew that all of us, again, were part of that diversity effort. We tried to make sure that it was plaid, in other words, integrated throughout the system. But we also knew with measurement, if you don't know where you're going, any road will get you there. So we looked at measuring diversity, and I must say, as you know, that it's always like holding Jell-O, because even though we have those 5 drivers, and we knew then we had conceptual clarity, if we think about if we were driving from Boston to LA, you know, we could change drivers to be more efficient because that would be a very long drive, but it also would mean that we have to make sure that we're all going in the same direction. So my role in our office role in the Diversity and Inclusion Office became to really harness all of that great energy and all the champions that we had, that it was going into this, that we were going all in the same direction. So we had a scorecard, a number of scorecard indicators, and scorecards are really about measuring the progress. We looked at our engagement, and we took some scorecard indicators as participating in our diversity program and evaluation results, and also our diversity survey results. We looked at the inclusive academic learning and work environment, and the scorecard indicators there were, again, our policies, practices, procedures. We annually review them for our inclusive language and the diversity impact. We looked at our diversity councils, and we have a number of employee resource groups that we utilize as key informants to the work that we're doing. We have a number of mentoring initiatives that we want to make sure that result in increased promotion and retention for our women and underrepresented groups. We're looking at our cultural competency, and we looked at the number of trainings. We looked at our courses in terms of the multiculturalism that is woven through there, the social determinants of health literacy, and we also, again, on our clinical side, look at our HCAP scores. We look at the community. We also look to see that we have a viable supplier diversity program and that we're branded in the community for diversity and inclusion. And we also look at our talent management to make sure that our recruitment, retention, and promotion indicators, as well as our student access and success indicators, show that we are increasing our diversity there. This is a simple tool that I also use for when we're just doing department meetings or talking with faculty council or executive council. We put up the group, and then we ask, for example, this is a general and then just says people strategy, but we'll put some indicators there of things that we have done, and then we ask them for our report card on it. So this is more of an evaluation tool, a very simple evaluation tool, but it's given us great feedback. And also, we can take the same indicators and then give it to different groups and see how each group then is experiencing us. And we can do that periodically throughout the year. We also look at having a diversity dashboard, and again, this is just a sample one, where we take those indicators on the side, and then you can look to see that the more red that's there in terms of best in class, the better it is. And so we ask people again to rank us in terms of what we're doing in terms of those dimensions. And us means everyone, not just the diversity and inclusion in office. And we can see then visually what we look like when we put those numbers into that dashboard. This is another dashboard that we use for the strategic goal process. And it is a little bit more elaborate than that, in the sense that we have it mapped the goals, and then we have it mapped to the institutional strategic goal, and then we put down, and we go over this with our senior staff, and they're very engaged with this, using the status codes at the bottom, because at the end of the year, we definitely want to see more green than red, and we also want to look and see where we've made progress. So that is the tool that we've used that's also been helpful in getting people involved in the process. So the whole end game here is to look at how diversity is contributing to the mission, our business goals, and/or creating an inclusive learning and work environment as measured by, and I leave that blank because it could be whatever, it's the program, the initiative, or if there's a certain survey that you have, or whatever it is, but that's always what the metrics are about and trying to make them meaningful. We also, again, look at benchmarking because there are so many great benefits for benchmarking. One, of course, is the transparency to the organization about the efforts that are being made, and also looking at the gaps and where the successes are. It's a great tool in terms of benchmarking to know what some of the best practices are and to see what others are doing. To get that shared knowledge, to say, gee, what are the characteristics of this organization? What are they doing that, that we could put in place here? It also advances the understanding of academic medical centers for the profession and for us as an industry, if you will. And then also, of course, is the recognition for those who are, in terms of the success points. It's a great way to celebrate. One of the tools, again, that we use of the Diversity Engagement Survey that's put out by the AAMC, along with UMass Medical School, this has been very, very helpful for us in being able to benchmark and to improve our diversity engagement scores and to see how we're doing in the certain divisions, but also some of the things that we might say, well, every other academic medical center must be having some of these same issues because of the external demands, and yet if they're doing better than we are in that area, then we want to dig deeper and see what we can do. So that's just a brief overview of measurement and how we might make it more effective. I'm going to pass this ball over now to Dave McIntosh.
Great. Thank you so much. I'm really excited to be here today to share the perspective of a newer institution and an institution that's relatively new to the diversity game. I'm going to focus my attention today on overcoming resistance. Before I really get into that, though, I want to make sure that I cite, and I'm going to say it a couple of times, that this is a team effort. This is really larger than any one person or position. And so if you're really going to have success, it really has to be a broadly shared goal, or these have to be broadly shared goals. Before I came into the position, there was a number of really great champions who made sure that these sorts of things were written into the college strategic plan and the mission, and we've done some massaging since I've arrived, but these are our Fab 5 goals that relate to diversity and inclusion. I think as you write these, it's really important to consider what really speaks to your constituents, what's really going to get traction with them, and then what's reasonable for you to really address and make progress with. I think all of us can think of problems at our institution, but if you put these pie-in-the-sky aspirations into this, into your strategic plan and into your goals, and there's no possible way for you to accomplish those things, then you've set yourself up for a very, very difficult task. When we think about engaging resistance, and I'm going to get to this a little bit in a couple of minutes here, but it's really important to consider who's on your team. When I think about who's committed to diversity and inclusion, I think about this in terms of the normal curve. On the left-hand side there, we've got some detractors, and on the right-hand side, we've got our choir. Really, at the end of the day, we want to make sure that we're considering the folks in the middle there. These are the folks that seem like they're really empathetic, they seem like they care, but they might not necessarily have the language, or they might not have the nuance of understanding of the social construction of race or gender or socioeconomic status or sexual orientation, et cetera. And so what is going to really compel those folks to learn more about this and to become involved and engaged in these conversations? Is it going to be a mandate? Is it going to be shame? Is it going to be evidence from the literature? The reality is it's probably some of all of those things, but the literature has spoken really clear. Time and time again, people will do what others around them do. So that's why it's so critical to get that mean +1 standard deviation of folks really on your team, because once you've got that critical mass, you'll be able to shape the conversation in a really compelling way that fosters change for even the detractors. Before I really get into where we're at with our goals, I wanted to put out a couple of caveats. First, this process is not linear. We've had some ebbs and flows and starts and stops, as everyone will. And then the LCME standards are amazing, and that's your big stick. That's something that will allow you to do a great deal. But it's also important that you don't become much like the boy who cried wolf, so that you don't become the administrator that cried LCME. And so use that stick sparingly, I would say. Where we're at with our goals, it's important to note here that we focused on goals where we can really get some traction, because success equals capital in engaging detractors. And so once we've got some success in our pocket, we're able to have a different level of capital, and we've got a different level that we can engage in these conversations. Very, very briefly, we've got climate studies ongoing, and we've done this in a little bit of an innovative way. We ask 8 to 10 questions on our climate survey, but we do it every 3 months, and we focus on a particular identity group, and we get a tremendous response rate as a result. And so we're able to not only pull down data relatively quickly, but we're able to respond to the data, which is really, at the end of the day, what we're all looking for. We've been able to really capitalize on our connections to our main campus, Texas A&M, working with their Advanced Center and their Vice President for Diversity. And then we're using our data to create capacity that we can leverage into conversations, so that we can begin to talk about to the curriculum committee, to the staff resource team, faculty meetings about this is what cultural competence is, and this is why it's important, and this is how we're gonna address it at Texas A&M. The resistance that you can see often comes in many forms. There's the overt, which is not nearly as common. These are the things that typically are handled with formal processes, and so these are really, well, they're very uncomfortable, but they're oftentimes easily handled because there's processes and procedures in place. Much more difficult and much more common are the covert, the passive-aggressive sorts of things. In the literature, these are described by Daryl Wing Sue as microaggressions, and these can be both intentional and unintentional, but they both have the same outcome regardless of the intentionality. It's resistance that prevents you from being able to move the ball. What I would say is that, and I've had to learn this the hard way, is that you don't have time or energy to engage all of the resistance that comes your way. Sometimes resistance is a strategy to keep you busy so that you can't actually move the ball. And so I think that it's important to consider what's the most politically important resistance to engage, and where can you get the biggest bang for your buck. The last citation there is a caution about becoming overwhelmed. Even though many times it's not anyone's intention to overwhelm you as a strategy, it still has the exact same impact with it, which is it's very difficult to move the ball if you're overwhelmed. And so this is where it's so important to have diversity written into your strategic plan and into your mission, so that way you can request additional resources in order to continue to move the ball. Also, I think it's important that you're your own best PR person. So if you're engaging resistance, it's really great when you're able to get the narrative out ahead of the resistance. So have your elevator speech ready, highlighting your successes, because you oftentimes can be your own best PR. Okay, so specifically addressing the resistance, you want to make sure to use the arrows in your quiver here. And many times your resistance is going to come based on opinion. And so it'll be people anecdotally pulling down stories. Oh, I had a neighbor who did this, this, and this. Counter that with data. The data is your best friend, and so utilizing your headcount data, your climate data, your cultural competency data from your medical missions, from the AAMC, from the GQ, you've got a ton of data. So utilizing your data as well as your peer institutional data, so that's your regional peers as well as your aspirant peers, and then triangulate that with the literature. The medicine literature is amazing, but there's also a ton of literature about these very issues in sociology, education, anthropology, and communications. I would say then when you engage your resistance, do it after you've got some victories in your hand, once you've got some successes that you can build on, because sometimes this resistance is a function of power, and once you've got a little bit of power in your pocket, you can engage on fairer terms or on a closer to fair playing field. Speaking of power, utilizing the folks on your team so that you're not always the person in the hot seat is a very, very effective strategy. Remember, diversity doesn't only belong to you. you. It belongs to everybody in the institution. So rely on those folks who have majority privilege, especially in your institution, to also intervene. If they're bystanders in these sorts of hostile confrontations or in these spaces, train them up on how they can respond and how they can intervene and intersect with some of those conversations so that you're not always the one on the defensive. And then overcoming being overwhelmed, I think that you've got to share the love. With all of us probably have diversity committees, and I think those are powerful ways that we can farm out some of our work. Engaging faculty members I've found to be a really, really wonderful opportunity, because many times they have grant dollars that are associated with diversity, and they need to have some diversity outcomes and measures and initiatives that they can point to, and so they'll be willing to work with you, and they've got money in hand. And then again, engaging that institutional support, because it's part of the mission and it's everybody's job, is a very effective strategy as well. That is all I have time to share today, and so I'm going to go ahead and drag the ball down to Linda.
Great. Thank you so much, Dave, and I'm thrilled to be here today, and thank you all for joining us. I am going to play cleanup here and talk a little bit about tying all this together and, importantly, linking your diversity and inclusion strategic planning efforts with your overall institutional strategic plan. And I'm going to talk about that from a couple perspectives. So from the perspective of linking it across missions and also linking it throughout the elements of your strategic plan. So stepping back just for a minute, strategic plans aren't rocket science. They really are just designed to answer these 4 simple questions that you see up there. Where are we? Where should we be in the future? How should we get there? And are we getting there? And lots of the elements that you've heard my fellow panelists referencing today are really the structure upon which you hang an approach to answering those questions. So establishing mission and values, doing an assessment of your environment internally, externally, understanding where you are. From there, creating a future vision and some specific goals. And the important thing, and I think you've heard some great examples of that today around goals, is that goals should be measurable, that you set something up that you will know when you start to make progress towards the goal. Initiatives, how you're going to get to the goals, and then the operating plans, and that's also inclusive of budgets. All of the steps before then, if you do not have hardwired budgets and operating plans linked with your initiatives, you're not going to get too far. And then Dr. Plummer did a terrific set of examples on how metrics can be so powerful in assessing and in helping you to evaluate your efforts. But really we want to figure out how can the goals and strategies for diversity and inclusion be infused through all components of the institution's plan. There we go. So the first step, we've heard a couple of the panelists indicate, looking at your institution and understanding, is there a clear commitment already to diversity and inclusion, and how is this articulated? And you want to look at your mission and values and at any kind of vision and goals that you have set forth at the institutional level to see how you talk about and commit as an institution to diversity and inclusion. We updated our mission and vision at the WashU School of Medicine, and really we had gone through a process within the last 10 years to update the overall mission and vision. And since that time, really looked critically, I will say, aided by some of the LCME requirements to say, how can we include specific language that will provide that touchstone that Dave was just talking about. If we aren't making traction in our goals for diversity and inclusion, we can come back to the mission, we can come back to the vision and say, this is in here, we need to be making specific progress, and how are we doing it? And whether that's in looking for more resources, and whether that's looking for ways to integrate the efforts more broadly, whatever it is, it needs to be clearly articulated in the mission and vision for your institution. The different levels of the plan is another place that you can look at integrating diversity and inclusion initiatives. So you've got something clearly set forth in the vision. What about in your goals? As I said, do you have specific, clear, and measurable goals? And have you thought about what diversity and inclusion means at your specific institution? Is it clear how you're going to move toward those, and are they linked through your budgets and your operating plans? And I think Dave made a good point too, not just within your Office of Diversity or in the domain of human resources or faculty affairs or students, you know, wherever there's usually one or two places where there's a lot of enthusiasm and folks driving these efforts. But how are those initiatives and operating plans infused across your missions? Because, you know, let's face it, we are, as academic medical centers, extremely complex organizations. And sometimes simply for, you know, bandwidth purposes, we create strategic plans in silos. There can be your diversity and inclusion silo. There can be a clinical strategic plan for your faculty practice in hospitals. Perhaps your research strategic plan is separate and maybe links back with a non-medical school component of your university. And then, you know, there may be an education strategic plan which is either parallel or encompassing or somehow overlaps with some of the things for diversity and inclusion. So your opportunity here is to really develop those connections if you do have this sort of siloed approach to planning. One, as had been referenced earlier, is looking at the key stakeholders. Make sure that your leaders for your large clinical departments, if you have a head of a faculty practice in hospitals, that you're connecting with those key stakeholders in your planning efforts. Similarly, as was mentioned, faculty that bring in large grants, your associate deans or leaders of your research mission. Education tends to be fairly well integrated, but what we're looking for is ways that we can specifically bring value. So, you know, just a couple small examples here. In those strategic plans by area, you might have things like, we want to improve patient satisfaction by 10%. We want to decrease readmissions. In research, we're trying to increase enrollment in clinical trials. We need to keep our Cancer Center grant, create partnerships to advance disparities research. Sometimes there are specific examples where we can add value with the very initiatives that are already existing in the diversity and inclusion strategic plan. So if one were to look at patient satisfaction by grouping, you know, whether that's by race, whether that's by gender, you know, are there different results? Can training that is an initiative for cultural competence or whatever in diversity and inclusion add value so that what you end up with is taking advantage of those opportunities to align and infusing throughout your research, clinical, and education areas your diversity and inclusion initiatives. And really what that is going to do for you is, one, to give you more traction and sort of a level of visibility within the institution. And, you know, it improves the outcome because basically you are kind of getting hardwired into all the different key mission areas for each of your institutions. And what I want to end up with is coming back to that question, do we have diversity and inclusion strategies and tactics in the operating plans and budgets? And thinking again about the metrics, a fabulous presentation on really collecting a lot of data that Dr. Plummer did on putting together metrics, but making sure that those metrics are reported and reviewed in the appropriate settings. Because as I had mentioned, looking at implementation in complex organizations, you've got to have alignment between your initiatives, between resources, and amongst priorities. So one of the challenges when we are doing planning sort of in silos, it can be an initiative or a goal can be a high priority for one part of the institution, but doesn't even register on the radar for another part of the institution. So making sure that as priorities are set, they are accepted and embraced at an institutional level, not just within a single area. And one way to do that is, I think, bringing metrics to the table and making sure, most of us now, dashboards are sort of the new tool of the moment and are getting a lot of visibility and use throughout our institutions. Making sure that the metrics, some key metrics you have for showing the success of your diversity and inclusion efforts are included in your overall institutional scorecard, and keeping those in front of your key stakeholders raises both your visibility and ensures accountability. And so that is my last slide. I am going to move the ball to Ed Callahan, who will help us wrap up here. Thank you.
Fast slides as well. Okay. Let's see if I can manage that simple task. I want to. I'm with you here as the Western Regional Representative for the Steering Committee of the Group on Diversity and Inclusion. I want to thank the panelists, first off, for such an incredible set of presentations. Every one of you spoke very meaningfully and very powerfully on work that's very critical to all of us in the work that we do. Now, my role, my day job is I'm the Associate Dean for Academic Personnel at the University of California Davis School of Medicine. And that's not a diversity title, but the work is diversity work. So one of my points to you would be to make sure that you recognize that everybody in the institution shares responsibility for diversity and needs to be making significant contributions to diversity. Before we go into the questions, we want to let you know about a couple of things that are happening before the conference comes up. And of course, we want to emphasize the conference that's coming up at the end of June in Puerto Rico. So there is an interesting What's Up doc presentation on leading technology-based innovations in medical education coming up quite soon. And there will also be pre-recorded webinars that can be shared with you as you move along. We also want to give you a set of resources that you can use, including the planning guide this is built on, as well as other, the diversity engagement survey that Deborah Plummer developed, and other resources as well. So we're at this point, my colleague McBib Gamita, who will introduce himself in just a moment, and I will be passing your questions on to the panelists. So I'm going to invite McBib to introduce himself at this point and to introduce the first question to the panelists.
Yes, this is McBib Gameta from the Eastern Virginia Medical School, and also the Southern Regional Rep of the Group on Diversity and Inclusion. I also want to thank the wonderful panelists for a great presentation, and welcome all of you who are attending in great numbers. I would ask the first question that was posed by one of the participants to begin the conversation. The question is, do you often find it difficult getting buy-in from students on the subject of diversity, or are those conversations easy? And perhaps to expand it further, I would like to add, do you identify resistance by area as a strategic initiative as you develop your strategic planning of diversity and inclusion? And perhaps I should direct this question to Dr. Maria Soto-Green.
So thank you. That's an excellent question. This is the generation that feels that they understand and manage diversity. And when we've approached it, it's more of approaching it from an inclusive approach, in that students have to really see, understand that not everyone has had a journey that's equitable in life, and that how can they themselves, especially since they're transcending into the medical world, how they themselves, through raising their own self-awareness, can contribute not only to the patients, but also enhance their own self-awareness on how they can really not see that you're being exclusive of them in terms of, moving things forward. I know we enjoy 150 undergrads in the summer, and our TAs, for example, they're carefully selected, but they come and they apply, and they're a very diverse group, and the bonds that they develop across, cultures, races, language, is really very inspirational. So I think it's about saying, look, we're going to value you as an individual, but you in turn can really do that with others, and it doesn't mean that you're going to be shortchanged.
Thank you very much. Could I go with a second question then? I'd like to address this to all of the panelists, because each of you has moved in and taken an important leadership role in diversity and enhancing diversity within your institution. In the process of becoming a leader, people have to go through a tremendous amount of personal growth and transformation. I wonder if we could ask each of you to address what the most important personal transformation you've had to do as you've taken on increasing responsibility and diversity has been.
I guess I'll just lead off. This is Maria. I think as a woman and a minority woman, I will say that, the biggest transformation has really been, you do pay what individuals say the tax, of being tapped for probably the wrong reasons, but because I'm the type of person who engages all and engages in a respectful, mindful way of others, it's really proving through the work ethic. So I will say the transformation has been leading by example, continuing to work hard in this journey, and always looking at never being satisfied and resetting the bar, but always listening to colleagues and being respectful of the way that they're approaching diversity and inclusion. But it is incredibly a journey, and I think we've heard it from our colleagues that presented today.
This is Deborah, and I definitely would agree with Maria on that. I think for me, having been in this work for quite a bit right now, a long time, I've learned really that culture trumps performance, and culture can trump, any kind of effort that you have. And so really, really learning the culture and really looking at its history and the stakeholders and engaging and including everyone in that effort has been really important. And because people support what they help create. And so, if you have the end game in mind and you're pushing that agenda, I've also really learned that there's a difference between advocacy and strategy in this work. And sometimes, you really have to know the difference between those two. Because if you're advocating and not doing it strategically, you can fail.
I would like to ask another question. Perhaps this is also for Deborah. Benchmarking and then looking at best practices is a very important aspect of knowing where you are. Looking at all our institutions, which are very diverse in terms of size and scope, institutional and regional realities. How does benchmarking work?
Mm-hmm. That is an excellent question, and it has very special meaning for academic medical centers because, as you said, we're very complex organizations. And so, there is a group of us here at UMass Medical School and a group at AAMC that is really taking a deep dive into that, particularly around diversity and looking at the, how we can benchmark, for example, faculty, staff, students, residents, and then compare the demographics as well as the geographic locations to see if that has an impact on it. So we are looking at many variables, doing lots of different analysis on how that works. But one of the things that I know for us, even just in this preliminary stage of using the benchmark data here at UMass Medical School, is that it has stopped us from having excuses, on certain things. So, for example, I can be, frank in saying that, we have scored consistently lower on one item that's in the area, that we would thought we were doing really well in. And so we also made the excuse that because of the conditions that are happening, around compensation, around recruitment efforts, that and the hospital systems, et cetera, that, in medicine in general, that everyone was having these same issues. But that's not true when we looked at the benchmark. Obviously, some of the folks who are having those same external conditions that we experience are doing better. And so it has caused us to go deeper. And so although, you can look at it in the form of resistance, as, when Dave was talking about resistance, I do think, learning how to manage resistance is one of the other areas where we'll go deeper on as well, because we need to look at how resistance shows up, particularly when we're looking at data.
So another question that has come in is the question about how you determine who it is that needs to be at the table when you start to set your diversity goals at your institution.
I just, this is Maria, I would just support strongly so that it just doesn't come from your rote memorization. I think we started this out earlier, and I'm assuming, Deborah and the others will echo that sentiment. I go through rosters, and I think that's incredibly important, and then I do use a circle of colleagues and say, okay, these are what I think, I go and work with the dean, with others, and I've been really quite, I guess, fascinated. I remember one time I invited an administrator, and the individual felt like, wow, why me? And so it's a fascinating thing. You do bring people who really, we haven't really invited them to the table as we should, and therefore we don't really push, we're not able to look at diversity and inclusion and many of the initiatives, I would argue, beyond diversity and inclusion in the most comprehensive way when we don't look at, at it from a comprehensive lens. But I use rosters, I look at lists, I look at everything so that way I make sure, did I miss something? Did I miss an individual? What do they bring to the table?
I think another really important way to look at that, and I appreciate that looking at rosters, is to consider who are the power brokers in your institution. Every institution has people who are thought and opinion leaders, and it doesn't necessarily follow the organizational hierarchy. So consider who are the real vocal people, the people who other people tend to look at and really value and respect, and try and get those folks, because those folks can, whereas you can have an individual conversation with one person, these folks can be spreading your message all over your college campus, and so I think those are critical as well.
I would agree with that, in the sense that, if you cascade and get a diagonal slice of your institution, you're going to be well served. And then also using the existing bodies. I try to use all of the existing bodies to do the road show. I'm always on the road. As I say, with any initiative that we're doing, we start with faculty council, executive council. We go to the admissions group, we go to the nursing council. We go to every single existing group and get a calendar and make sure that we have done the cascaded through every one of those groups.
And I think if I may add, one of the other powerful tools is also when you do bring the groups together, at the table in the various venues, it's always important to make it clear to them that they should feel empowered. They also have, the reason you have them there is that they are a sphere of influence. And therefore, by being at the table, they can have their own dialogue, exchanges, other individuals then feel that their voices have been heard. And so when they come back, they're not just representing their vision, but they're also shaped by the many other conversations that they've had. And so we really say that explicitly in everything that we do.
This is Linda. I would say one other source for potential supporters is, you often through your training processes or your planning efforts have clear individuals who may have started out as skeptics and who really go through kind of a personal transformation and transition. And having those people who kind of have been converted, if you will, to really being supportive of your efforts, kind of, taking David's standard deviation, bringing those people forward, and if they're willing to take a more visible role, I think is really powerful for moving your whole curve forward.
We have another question here, which is one of the difficult questions, and it is about faculty. And to just put it maybe in the context of the conversation, what kind of strategic initiatives from your experience has been successful, or do you envision in terms of, pipeline programming for faculty diversity in the context of strategic planning?
So for us, again, being in Newark, it's been something historical with the, with the commitment to the community. But that's an excellent question. So what we've done is, myself, I've been able to garner federal dollars for over 20 years that encompasses growing the focusing on faculty diversity. So then we really look at it from an entire talent pool, and it takes years to groom one. So everything from exposing our medical students to those, to thinking about early on, becoming faculty, to targeting the trainees, to celebrating and really having difficult conversations, with the chairs around what is it that a faculty member who is diverse, what would they bring that in terms of assets and strengths. And really that's been the journey. I won't say that it's easy at all. You will need to have difficult conversations because there's still myths about abilities and inabilities. But I think that that's really been, I think the scorecard, going back to Deborah's point, I think the missions management tool has also been helpful. If you look at it, they have two things that they measure, and that's the diversity of your graduates over a period of time that keeps moving. So they move the years, obviously, and then they give you a snapshot on how do you compare and what percentile are you as it relates to women and to traditionally defined underrepresented minority faculty. And I think that that's a very good starting point. And then I would use simply resources that are available to you. I think the Centers of Excellence are very good places to start. The HRSA funded, because that's what we've been doing for many decades now, and then obviously, the AAMC through its programming.
So we don't actually have a really great place that a lot of folks of color and folks from underrepresented backgrounds would find desirable in College Station, Texas, necessarily. And so for us, we've really tried to attack that by working to create an amazing culture and climate within the institution so that we can become a destination based on people's ability to succeed within the institution. So we're really trying to build it through a climate, and that's part of our strategy, and we've written that right into our strategic plan because, yeah, that's our big arrow in the quiver.
Yeah, that's one for us as well here at UMass. We did some analysis first, so the assessment piece, and found that we've been pretty flat since 1975, which is not really, you know, any type of bragging point. We're just not very happy about that at all. We have a aggressive recruitment process and a faculty diversity scholarship program where we are specifically targeting with dollars, and it's 3 scholars that we try to bring in every year who will in the program, and they get $100,000 for every 3 years, for 3 consecutive years, for a total of $300,000 to support their research or their clinical, the clinical research or the bench research, in order to recruit folks and include that to the package. We also have a micro-communities process that's starting through Dr. Jean King, who is one of our diversity leaders and champion, and that will help to give folks the kind of support that they need. It's a form of a mentoring circle, and we do have mentoring circles for our students, and just really trying every effort, but that is really, really challenging for us.
We have had a residence and fellows diversity initiative, so providing support for residents, applicants to the resident fellow diversity program through Barnes-Jewish Hospital in an effort to attract underrepresented minorities. And we also have, I think, sort of similar to what Deborah just described, some additional startup support that's available to departments in recruitment of underrepresented minorities as well.
I'd like to add this main thing, which I think you're hearing from all of us, it does require having a pool of money that you can leverage and have your chairs and other chiefs be your partners. And then clearly it does have to exist within an institutional culture and climate. And so it's really important to also look at your senior leaders, you know, and have you also put the right individuals that can also message out, you know, what would be attractive to faculty. I will say, well, we right now are at the 70th percentile in that benchmark. I will say we're relatively flat also, and that one of the biggest challenges is really the retention, because, you know, this is a group, particularly if you're talking about underrepresented minority faculty, they're very, very mobile and marketable, and it's really focusing on what else can you do to create the type of climate, you know, that really would help them see themselves into the future and be, you know, and thrive at your institution, and that's a challenge.
Those are beautiful answers to that question, and they perhaps they lead into a little bit deeper dive into the issue with another question, which is what is it that you do specifically that doesn't just involve putting money in, but programs or other efforts that you do to try to enhance the level of inclusion that takes place in your institution? And do you cross faculty and staff borders as you do that?
Well, you know, one of the things that we do that doesn't require money, although we have recently put a dollar amount to it to make it equal with the other awards, or the Chancellor's Awards. We have an award that goes out at the highest level, which we give out at the Martin Luther King Day celebration to an individual or a team who has advanced institutional excellence through diversity, and one who has advanced institutional excellence through civility. And they have become very coveted awards, and they get a huge, like, hotel-type poster that's put in the hallway, along with other ones that are in teaching and research, et cetera. And it's very, you know, and people really look for, we have grown in the nominations that come in, and then people look forward to it. We, you know, originally when we started, there was not a dollar amount attached to it. It was just simply the recognition. But then over time, our chancellor wanted to honor that the same way other kind of the chancellor's medals get awarded, so they do get a nice little monetary prize that goes with it. But, you know, that's not even advertised, and people don't even realize that until after they get the word, they go, oh my gosh, I didn't realize it had, money attached. But it was something that I think anyone can do by just recognizing the folks who are doing really well.
Very good answer. I would ask one more question, and then I think David earlier mentioned a little bit about how do you maintain the momentum as you build the strategic plan. Then there is all this energy and momentum that is built institutionally, and how do you maintain that momentum? And particularly since outcomes of diversity are really long-ranging in many ways.
I can jump in real quick. I think that it's something where we can really build momentum by with the results of our climate surveys. And so for us, we launched these very short climate surveys, and people get really excited when they see the results, and so that reinvigorates people. And then when we start discussing strategies to remediate the results that we found, that becomes very exciting. And so it begins to build momentum in a cool way because people are constantly engaged with new things to do. I think there has to be things that we're conquering and things that we're out there, we're slaying dragons, and so that's what keeps people engaged and involved in the conversation. And if you lose that momentum, I think it's really, really hard to build it back up. And so really there's a lot of time and energy I spend in my office trying to think of what is the next thing that we can conquer, what's the next thing we can claim victory over because we've done this and we've done this and we've done this. And so for us, it's achievement becomes the self-fulfilling prophecy.
Thank you so much. That's a great answer. Ed?
So I want to thank the panelists one more time and all of the participants. Wonderful questions and incredibly wonderful answers. Thank you all.
Thank you so much.